We have different types of fistulas, and we are seeing a change in the trend. We have the obstetric fistulas, which are usually due to neglected obstructed labor. Mostly in the younger population, someone gets into labor and they take a very long time before an intervention comes. So those ones, we are seeing the trend is now going a bit lower, and what is increasing now is what we call the iatrogenic fistulas, and those are iatrogenic are the ones which are caused due to medical procedures mostly. You know, we have a cesarean section being done and then the bladder is accidentally cut, and the patient starts leaking urine. Not because they went to hospital early, but these are the ones we are seeing are actually increasing. So the trend is changing also because previously when this facility had just started, most of the patients that we're seeing are those that had suffered with obstetric fistula for very long years, some for maybe 10, 15, you know. But right now the trend we are also seeing is that majority of the patients that are coming within the first year. Even actually the biggest majority, the first 6 months of getting the injury of starting to leak urine, they are accessing care earlier, which tells us something about this information being out there, and that is good because the earlier they come, the less the amount of time they spend suffering from this debilitating condition. This facility, we have an annual treatment target of 500 patients, annual, that's in the year. And these are divided amongst the conditions that we treat, but more than a third, most of the times, more than a third, or at least a third of them are obstetric fistulas. We also deal with the perineal tears that we talked about, and many of them also are in some of the classifications. You would classify the 4th degree tears where there is one connection between the birth canal and the rectum. Those are also in some classifications counted as fistulas, because a fistula is really an abnormal communication between two surfaces, two epithelial surfaces. So those are also another portion of the ones we manage. But basically a third of all the patients, a third of that number of the 500 patients are fistulas, obstetric fistulas. So currently we get our patients from all over Uganda. That's why even when we're in the ward, you see we had to speak a bit of every language. And but the facility being here, many of our patients are from the Greater Teso region. We have a number also from Lango. We have a number from the Sebei region, and also from Karamoja, which is good because they are actually able to access care. But then all over the country, it is scattered. Busia, that is the part of East, I think. Yes, but even we get as far as beyond, you know, Kampala, Mubende, Mbarara, you know, all those different areas. We actually do get patients from that far. Fistula is it's a condition that affects the entire family. Yeah, sometimes it occurs during the first childbirth, but many times even we've had people who it's the 5th, 6th, 7th pregnancy where this condition is happening. We already know that women are the backbones of families, and in our society in Uganda, we find that even much of the work is left for the women. So when the mother is down, and one, it affects minus the acid labor. And if they get obstructed labor, that's the single most commonest cause of obstetric fistula. When they get obstructed labor, the baby is not able to pass through the birth canal, and they keep waiting until finally that connection ends up forming. The tissues between the bladder and the birth canal die, and then the person ends up with fistula. Number 2, most of these girls will not be economically able to take care of a pregnancy, as well as even antenatal. Like in case sometimes you go to hospital and this happen, we know them. There are no gloves, there are no what, and you will not be worked on unless you have some of these things. These shortages happen. So someone who is young most probably has not saved up enough actually to be able to afford these things that are needed, what we call the birth preparedness plan. So even nutrition wise, also you'll find that these younger teenagers, these younger ladies who get pregnant as teenagers are not taking the right nutrition such that their bodies also do not develop that well in order for them to have a normal delivery.
Teenage marriages. As I talk now, I saw the statistics. Teso and sorority we are having high adolescent fertility. I think we are leading in the whole country, Teso. And when we see our statistics, we are also there. I don't know whether because the hospital is near, we can easily get the information and Lango, or it is the reality. But what I'm talking about is UBOS. It indicates Teso having high adolescent fertility rate. That means those are young girls who get pregnant when they are not yet mature to handle the issues of what? Delivering. But as they told us, the highest percentage of mothers they receive here, those are now younger mothers even, because they are below. They are the highest percentage, meaning we are having high adolescent fertility, we are having early marriages. And in those early marriages, there's no attention given to these girls. Why? Like she said, some are rape cases, some are forced, some are organized because of poverty. The poverty level, someone sees a daughter that now this is a what? A transaction business. You transact your daughter. But I pray from here, we go and spread the right messages. Let the male be involved. Male involvement is very important. I know in a home, when the dad is there, can he stand and say, no, I'm not giving out my what? My daughter. A dad can provide. The dad, the husband, is able to help the mother overcome some of those delays. They were telling us we have 3 delays. But the first 2, with the involvement of the male partner, everything is possible. Maybe the 3rd delay in the hospital there, that's when we can say that is a different issue. But where we need the male support, you are the one to tell her, please,